Seconds to get started and give folks a minute to get settled. My name is Laura Zachary. I'm an integrative pharmacist and a nutritionist, and I specialize in integrative medicine, functional medicine, and lifestyle medicine, essentially using those modalities, those frameworks to help our patients to implement lifestyle changes, to implement dietary changes, to support them in reducing the risk of chronic disease. And I'm really excited today to be talking to one of my friends about the topic specifically of perimenopause and how it impacts women in the workplace and how it can feel like you're going crazy and you're not performing the way you normally would expect to. And then we're going to use that as a jumping off point to help us understand how we can better support our hormones using some of these principles. And I'm happy to bring on Dr. Shelley Bomick. Hi, Shelley, how are you?
I'm good. How are you this lovely Friday afternoon?
I'm doing really well. So happy that we got a chance to have this conversation. But first, can you give folks just a little bit background and how you got to this specific place and this specific interest?
Yes, happy to. So yes, hello everyone. I'm Dr. Shelley Bomick. I am a preventive medicine and lifestyle medicine physician based in New York City, and I work with organizations on helping them address burnout, especially for women of color. And this work is really personal for me because of my own experiences with stress and burnout and mental health issues. It wasn't that long ago that I literally was found myself at the edge of the subway platform during a rush hour one evening, thinking about pushing myself over that edge. And to step away was from that edge was a journey in and of itself, but it was in that process, in that recovery, that I came to realize mindset is medicine, and that you really can do something about your health and well-being. You have control even when it feels like you don't. And so it was just such a life-changing lesson for me to learn that as a physician, I feel like it's my duty to pass that message on to other people, especially to other women and people of color, because I don't want them to end up at that same edge. So that was the whole inspiration for starting Platform Wellness and working with these organizations on improving stress and burnout and employee wellness. So
I'm so grateful to you for sharing that piece of vulnerability and how challenging it can get. It can get very serious very quickly. And often there's a lot of stigma and a lot of hushed tones when it comes to some of these topics. And I think a lot of women, especially now with social media, are finding a little bit of solace, finding a little bit of connection with other people that are going through some of this. And certainly then you add the layer of stigma that comes with culture, comes with certain communities of color, that comes with certain backgrounds and histories, and it really complicates the situation. So what you're doing is exceptionally important. And we're going to approach this from the perspective of perimenopause, from the perspective of hormone wellness. So can you tell us a little bit about what you're seeing? Like, what has been your experience in working with this particular community, with this particular group?
Yeah. It's interesting because this is, well, first of all, menopause, stress, and burnout, they definitely overlap in terms of their signs and symptoms. So sometimes it's hard to kind of tease one apart from the other, and they definitely contribute, one to one another. So that's one thing. But it's it's interesting, especially talking about menopause, perimenopause in the workplace, because women, especially who are in leadership roles, the age at which we typically see individuals go through menopause is around early 50s. And perimenopause, so the time before that actual menopause date, that can be 10 years, that those changes in your body can start up to 10 years prior, so early 40s. And it's that age range, though, that we typically see women start to finally get into the leadership roles that they've always been working towards, climbing up that ladder for. And so to experience some of the signs and symptoms of menopause right when you hit that peak level in your career, it can be really, really difficult for individuals. I definitely have patients, executives who come through the doors who are like, look, I am eating the same foods. I have the same CrossFit workout routine that I've had the past 5, 10 years. Why am I gaining weight? why am I all of a sudden not able to make decisions, as fast as I used to be able to? Like, what is going on? It can be really, it can be really jarring for people, and especially depending on the severity of your signs and symptoms. So really something that we need to address in the workplace. And it's interesting because the UK is a lot more progressive when it comes to talking about menopause in the workplace versus the US. They did a study in 2019, and they found that 3 out of 5 women are negatively impacted by menopause at work. That's like a really big number if you think about it. 3 out of 5 women in your workplace are not able to thrive. They're not able to show up and work like they would want to, or and how the employers would want them to. So it's really imperative for employers to take note of this and be able to create an environment within the workplace that supports individuals who are going through these changes of perimenopause and menopause. So yeah.
I couldn't agree more. And I think I'm happy to see that there is some progress in this conversation when it comes to corporate wellness. It's really a big topic with healthcare wellness as well. And we're seeing this come up more and more. And the conversation is really evolving because of the rates of mental health issues and suicidality in healthcare professionals. So I'm really glad to hear that it's becoming more and more talked about. And are you seeing better programs being set up as a result? Are you seeing enough programs being set up as a result?
I am seeing programs, starting to come about, conversations that are starting to be had, but definitely not enough. We're just scratching the surface. Maybe a company's women's ERG, their employee resource group, maybe they'll have a session related to this topic. A lot of times, especially with everything that's going on in our country regarding pregnancy rights and all of that, you'll hear a lot about fertility issues in the workplace and supporting new parents in the workplace. But this topic of menopause doesn't necessarily make it into that same conversation all the time, or doesn't necessarily get the same amount of airtime that these other topics do. And all of these topics, they all deserve more airtime than they're currently getting. But menopause in particular, I think, is just not, hasn't reached that same level in terms of, yeah.
Yeah, it just got me thinking that, we think we're talking about reproductive health and we're talking about, the rights of women to have autonomy on their body, but we sort of don't put menopause in with reproductive health. It's sort of like an afterthought. And I think that's part of the disconnect. It's a cultural stigma, again, a cultural identity. Yeah.
Yeah, absolutely. Absolutely.
Yeah. Well, so let's back up here and can we just clear the air about perimenopause and menopause? When does, we talked about how menopause typically starts in women, typically in their 50s, although that could be variable. I think there's a misconception about perimenopause and when perimenopause starts. And can you clarify that for us a little bit?
Yeah. So let me start with the definition of menopause first, because I think that'll be helpful. So menopause, it is basically the time when a woman does not have her period for 12 consecutive months. And so the average age that we see that here in the US is age 51. So again, early 50s is typically when individuals will experience menopause. Perimenopause can start in your early 40s. For some individuals, it may even start earlier. And so it is that period before menopause where your body is starting to go through some of these changes because of decreasing hormone levels with estrogen, with progesterone. So that is perimenopause. So, I mean, we're looking at almost it can last almost a decade or even more in some cases. So it's a long process. And then postmenopause is essentially the rest of your life after menopause. It is the rest of your life. Your hormone levels are, will start to finally not be all wonky and all over the place.
They won't cycle. They'll just continue to be.
Yeah, you'll reach that steady state. And
Mhm.
for postmenopause in particular, there are three aspects of your health that we really look at, and that's your brain, your bones, and your heart. And we can kind of talk about that later, but those are three really, really important aspects of the health to focus on when you're in that postmenopausal stage or phase. So that is this distinction between those three main categories.
I think that's super helpful to understand, and I'm glad we're going to put a pin in those in those three categories that you talked about, because that's essentially what changes in terms of health risk. And I think something that folks don't understand, or some folks don't understand, is that estrogen in premenopausal women is actually protective, and that's part of the reason that as estrogen levels start to decline, we start to see an increased risk in those disease states. So that said, I think a lot of women feel like as they're entering perimenopause, it's going to be a very obvious state that they're starting to get very irregular cycles, and it's very obvious that they're premenopausal. But in fact, you can start going through perimenopause or premenopause, like, what is it, 15 years before you actually hit menopause. And there's varying degrees of what those symptoms may present as. And can you speak a little bit to that? Because now you're putting us in our mid 30s, and that might be a little shocking for some of us.
Yeah, I mean, what symptoms do you not experience during this phase or as a result of these hormonal changes, you know? I think the more common ones that we talk about are the hot flashes, the night sweats, but it really runs the gamut. Brain fog, for example, difficulty concentrating. That is something that folks deal with when they're going through these menopausal changes. But a lot of folks experience brain fog despite not experiencing menopause. So there's definitely overlap between signs and symptoms here. The emotional and mental component to this, the depression, the anxiety, the irritability, the mood swings, those are all things that you can experience, changes that you can experience during this phase. Joint pains, digestive issues, acne. I mean, yeah, we could
Acne.
think about. I know, right? I mean, as I was just saying that, I'm like, oh man. No, I thought I left it behind. Yeah. But yeah, it comes back. It comes back. Those hormonal changes. Oh,
Well, and it makes sense, right? Because a lot of acne, not all of it, but a lot of acne is mediated by hormonal fluctuations. That's why it hits us in during puberty and high school, when our hormones are fluctuating and still sort of like going haywire, trying to settle on where they want to be. And so it makes sense that on the other side of that, in cycling, people who are cycling, that it would actually end up also creating a similar kind of haywire event that manifests in their skin, that shows up as acne. So it totally makes sense, especially as estrogen levels are dropping and androgen levels may be relatively higher, that it would drive this like acne picture. So yeah, it's super interesting. And I think the thing, again, like Dr. Carrie Jones is like one of my go-to resources when it comes to women's health and women's hormones in particular. And one of the things she says that what we want to do is to gracefully glide into menopause rather than crash into it. And what she's talking about there is the idea that, as you sort of understand and prepare for this inevitable, decline in change in hormones, there are things that we can start to do even as early in our 20s and 30s to start to gradually shift that, so that by the time we hit that period where the fluctuations get a little bit more intense, they're not as intense, and they're not manifesting, at least for me, the most important piece in the psychological, in the emotional aspect, that there's some grounding to it that's not pushing us and really testing our like mental stamina. So do you have any thoughts or suggestions as to how we can approach that? And then I definitely want to circle back to those disease state risks and the controversial HRT. I think that's a really important conversation.
yeah. So I will say that I think the most important thing that you can do for yourself is to remain flexible. And what I mean by that is, our bodies, regardless of whether or not we're going through menopausal changes, our body goes through changes all the time. And I think where we run into trouble is when we become so rigid in our lifestyle, in our habits, in our lifestyle practices, that it starts to create this friction, right? We don't listen to our body when these changes are happening, and as a result, we're just experiencing more stress and more frustration because we feel
And
like we
can
can't.
I interrupt to just say that sometimes we're also gaslit into thinking these things too,
Ooh, that's a word.
right?
That's a word.
Sometimes we're told that these things are in our head or that it's just stress, and we're not actually supported in figuring out what our body is trying to tell us. So I want to kind of note that.
No, no, you asked about misconceptions earlier on. I think the top three misconceptions when it comes to menopause. Number one is that it's abnormal, that there's something wrong with your body, which is absolutely not the case. This is a natural process that's occurring.
Mhm.
Number two, that you're crazy, which is exactly what you're talking about now. And unfortunately, in our medical education and training, it's not super nuanced. We don't get so much exposure to how to approach changes like these, health changes like these. So there are organizations like the North American Menopause Society that provide certifications for healthcare providers to
Mhm.
just become more knowledgeable and aware. So I think that's an important piece too. You really have to, for any individual, you really want to be able to work with healthcare providers that you know, like, and trust, and that are knowledgeable and educated about these topics. And then the third misconception was that you can't do anything about it, which I know we're like talking about right now. So circling back.
Yeah.
um,
Circle back to, yeah, there, yes, let's lean into that. What are some of the options, particularly for women, whether you're in your 30s or you're well into perimenopause at this point? What are some of your options? What can you do?
Yeah, yeah. So I think it falls into two or three main buckets. And as a lifestyle medicine physician, I am all, lifestyle changes, behaviors changes, habits, like that is always going to be my first and foremost recommendation. Being able to take a look at your lifestyle and see what you can, see how you can adapt. And this is where that flexibility piece becomes really important. With so say for example, actually using the example of the patient who was doing CrossFit 4 or 5 times a week and still gaining weight. There's the exercise routine that you are used to doing for the past several years. You might need to rethink what that exercise routine looks like.
Yeah.
And that's okay. um, there are other lifestyle practices. Mainly, I would say nutrition, physical activity, and sleep. Those would probably be the three main domains that I would have individuals focus on when it comes to trying to deal with the signs and symptoms of menopause.
Mhm.
Sleep in particular, for example, it's so, it can be really, really, it's really hard for a lot of individuals, in general. And then when you are going through these menopausal changes, the night sweats that you experience, that can keep you up, that can keep you from getting a good night's sleep, and then you're not at your best the following day, and oh, hey, there's that brain fog. It
Mhm.
kind of gets into this cycle. So
Exasperating the other symptoms that were already disruptive, and it just becomes a downward spiral. Yeah.
exactly, yeah. So being really diligent and purposeful about your sleep routine
Mhm.
is really critical when it comes to this. Going to bed at the same trying to go to bed at the same time every day. And unfortunately, weekends, catching up on weekends, it doesn't work that way. Your sleep doesn't work that way. You need to go to bed and wake up at the same time every day, every night. Making sure that your bedroom is only for sleep and sex, and not bringing your laptop into bed to finish up those emails or watch that extra Netflix episode. So yeah,
I'm
being
feeling called out right now.
I know. But yeah, you know, it's about creating that environment, that restful environment where you can get the sleep that you need, because it is just important in terms of getting that rest and recovery for your overall health and well being. Um,
Absolutely. And we talked a little bit about some of the risk factors that are involved, like cardiovascular disease, endocrine disease. We don't often think of osteopenia and osteoporosis as a metabolic disease, but it's part of that metabolic continuum, right? And all of them are so significantly impacted by sleep, right? And so you could start to see the thread that then ties the whole thing together, where you've got your hormones that are disrupted, you've got your sleep, that you've got then cardiovascular risks that are increased, metabolic risks that are increased, all stemming from this sleep disruption that's sort of sitting underneath all of it. And I think that's a really, I think, important concept, that it's your sleep over your lifetime too. That's part of the reason why you can't just catch up on the weekend.
right, exactly. Yeah, so important. And as you mentioned earlier too, estrogen, it is protective for our bodies, and that's why, like we were saying, in that postmenopausal phase, uh, we really do want to hone in on our heart health and our brain health and our bone health too. So, you know, for bone health, being able to prevent osteoporosis by doing weight bearing activities, making
Yes.
sure that those are incorporated now into your physical activity, into your exercise routine if it isn't already. You know, with brain health, 2 out of 3 Alzheimer's patients are women. You know, it really is an issue for, especially for women. So being able to focus on, you know, on your brain health is another important thing to look at. And heart health, I know we talked about, but again, that physical activity component, the nutrition, you know, following a Mediterranean diet in particular can be really helpful, just because of the, you know, the fresh fruits, the vegetables, the whole grains, the lean proteins.
Yes.
You know,
And it can contribute to the microbiome, and the microbiome is heavily involved in metabolizing estrogen in a healthy way. There's also a relationship with certain foods and certain nutrients on, again, how they metabolize and how they can actually promote the production of estrogen as well. So certain foods can be used therapeutically to target and enhance not only the production, but then the proper metabolism and breakdown of those estrogens and the metabolites of those estrogens, as well as support the production of progesterone, which is a big component of that sleep piece, and the decline of progesterone is sort of what contributes to part of that insomnia piece as well. And then, of course, testosterone. We don't talk about testosterone in women, but having robust amounts of testosterone is part of our anti-aging mechanism as well. So all these things that you're talking about, all these various components of the Mediterranean diet, lifestyle, sleep, stress management, all of them are just, they're hitting on so many different aspects that are involved in a very complex cycle. But I want to come back to the stress piece, because this is a big one, especially when it comes to women who are working, high achievers, high performers, women. Part of the reason why you might not tolerate that an intense workout the way that you used to. Can you speak a little bit to the stress and the impact on your hormones, and particularly maybe the connection between like DHEA and the production of our sex hormones? Color that in for us.
yeah. Well, you know, I will say that stress, you know, as we most folks know, stress, we think about cortisol, you know, increased levels of cortisol that then that spike when we get stressed. And it's really the chronic stress that we worry about.
Mm.
Acute stress, or stressors that happen every now and then, those can actually be beneficial for us. Those can
Mhm.
actually make us, you know, or
More
stronger,
resilient.
more resilient. Exactly.
Yeah.
Thank you. But it's the chronic stress that leads to inflammation in the body, and it creates that wear and tear that
Yeah.
then has impacts, you know, down the road, whether it is you know, whether it's your heart health or with other
And I want to just kind of fill in there for folks that are like, well, what's the difference between this healthy acute stress and
mm,
a negative chronic stress? Exercise is a form of a healthy acute stress. Heat exposure and cold exposure are examples of also a stress that's acute that helps to build resilience. And this is part of the reason that fasting might also be beneficial. These are all stressors that have a start and an end. And to that, there's almost like lifting weights helps to build muscles and helps build muscle memory. Similarly, that stress response is like building resilience in our ability to withstand stress. It's to your point, when it becomes protracted, prolonged, and there's excess, particularly cortisol demand, that's when we start to see things, the wheels fall off the wagon.
Yeah, yeah. So I just realized that we have 3 minutes left,
Oh
and
my gosh.
we haven't talked about HRT yet. So I feel like we could slide that in right there.
Yeah, let's slide.
Yeah, no, and I would love to hear this from you. I mean,
Yeah.
I think your background is so unique in terms of having the education, the training in pharmacology and in nutrition to be able to approach this topic. So I'm gonna throw it back at you,
Oh my
actually.
gosh. Okay, so 3 minutes to talk about one of the most controversial
I
topics in women's health. Let's see. Okay, so first of all, I think we have to rethink what we think of HRT is. I think there's this idea that it falls into one category or another. It's either good or bad. It's either bioidentical or it's synthetic. And I think that's already we're getting into murky territory there. A lot of the concern around HRT stems from research from the late 90s that said that there was increased risk of cardiovascular events in women who took estrogen replacement. The problem was, and some of the pushback to that is that the form of the estrogen that was used then was not bioidentical, wasn't close enough to mimicking our risk. And some of the debate now is, well, can we even trust that data? Because one, now we have different forms of estrogen that we're using, and we have some conflicting data coming out in using that. Another piece of this is also dosing. Just like with oral contraceptives, we started with really high doses, and over decades, we started to go down to micro doses, essentially, of hormones to create the same effect. In fact, improved efficacy and reduced adverse events. The same thing is true with hormone replacement when it comes to perimenopause and menopause. And I think we're seeing a lot of really interesting uses for hormone replacement therapy. Particularly, I'm interested in what we're doing with bioidentical hormone replacement. And again, not focusing strictly on estrogen, but also bringing in progesterone and testosterone into the conversation. And then really focusing on detoxification, on the metabolism piece. Because if all I do is give you the hormone as it is when you first produce it, but I don't support your ability to metabolize it, detoxify it, and poop it out, then I am leaving you in a situation where you have too much hormone being produced. And both testosterone and estrogen, will focus on estrogen because that's the primary one in women, are capable of helping things grow. That's part of the reason we're able to help a fetus grow. But they're capable of helping cancer cells grow. And so that's where the concern around cancer risk comes in. Because if I'm not helping you metabolize your estrogen, whether I'm using HRT, I'm using oral contraceptives, or I'm using no hormone replacement, and you're excessively producing estrogen and it's going down the wrong metabolic pathways, then I am enhancing that potentially negative mechanism. So at the end of the day, the other piece that I think is missing from the conversation is the conversation about detoxification, about making sure folks are pooping, making sure our microbiomes are healthy, our gut health is intact, that we have good intestinal permeability, and that there's low inflammation in the body in general. All those are going to contribute to whether or not there's added risk when it comes to HRT. And then we could start having a conversation about the form of HRT, the balance of the hormones, being more holistic in our approach, mimicking what the body would make. And then when do we even start it? Do we start it with women in their 30s? Do we start it with women as they start to become symptomatic? Do we wait until they're in menopause? What do we do with women who have had full hysterectomies? So I think we can then start having a more robust conversations about the pros and the cons.
Yeah, I mean, I think the point about it not being all or nothing, this isn't black or white. I mean, even like you were talking about, even in terms of the forms of HRT, you can have forms that are systemic that, will be,
Yes.
in your bloodstream versus forms that are local, creams that you can use for different symptoms. So it's, there's a lot of nuance. There's a lot of, you know, there's a lot of ways that you can approach this, and that's why, again, that point about really being able to work with healthcare providers that you know, like, and trust,
Yes.
it's so, so key, because that's, you want to be able to have these conversations with your provider.
And you have to start early.
Mm,
This conversation needs to be had in your 20s and 30s about how to protect and preserve your hormones. And then as you're entering perimenopause stages in your 30s and 40s, then how do we optimize these that are in an age appropriate way? And then as you're approaching menopause in your 50s and beyond, how are we maintaining and or supporting you in a way that's appropriate for you, that takes into consideration all your risk factors, right? And so I think that this conversation, we often, again, going back to comparing it to the fertility conversation, very often we only talk about fertility when somebody's trying to get pregnant, but really these conversations need to be had from the beginning of the life cycle, and we're not doing, I think, enough. Generally speaking, you're an exception to this, to that, but I think we are not doing enough to have this conversation early enough with our patients.
yeah, yeah. And I guess in closing, I'll say too that, um, you know, this menopause, this pause, can actually be, you can actually welcome it. It is really helpful sometimes just to pause and reflect on what is happening to our body, and what how we might need to take care of our bodies a little bit more,
Mhm.
nourish, sustain our bodies a little bit more. So in that sense, the pause is, it kind of gives you that moment to do that. But it doesn't have to stop you. It's a pause, but it doesn't have to. These signs, these symptoms of menopause, it's not like things are over. There is absolutely a lot more living that has to be done, and you can thrive. It's just a matter of listening to your body, getting the help that you need, and then working from there.
Absolutely. And I'll offer this. There are some indigenous cultures and some other some spiritual cultures that see menopause as a rite of passage, and that when a woman approaches and goes through menopause, she has actually reached the pinnacle of her wisdom. And so I think that is so powerful to think about. When I think about all the powerful women in my life, all the women that I look up to, they are these strong women in their 50s and their 60s that really have embodied that wisdom. And when we stop thinking of women as just vehicles for producing babies and we start to think of them more holistically, I think that starts to fit that picture a little bit
Yeah.
more. Yeah,
No, I love that holistic approach, and just holistic view on health and well-being. So
absolutely.
why I
Absolutely.
love talking to you.
Back at you. So I could keep having this conversation forever. If this is a topic that resonates for folks, would love, we're happy to continue talking about it. Let us know in the comments. If there's other, nuances of this conversation that you want to go into, we certainly could delve into this. I mean, there's so much to talk about. Thank you so much, Dr. Bomick. I really appreciate you. I appreciate what you're doing in this space, and really like your insights and the wisdom that you're bringing to this are just so powerful. So thank you so much for your time.
Yeah, no, thank you so much for having me, and we will talk soon.
Yes, we'll keep this conversation going.
Bye.
Bye.